Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, if you've watched this show before, every week I have a different guest on the program that talks about a healthcare issue or a service that we have here at KRMC. I've got a great guest on the program today, and I hope you'll join us because I think you'll find this of interest to you and your family. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Jessie Beloussow. Did I say that right?
Close.
Close.
Beloussow.
Beloussow. Sorry.
That's all right.
Jessie's a nurse practitioner working with Kingman Pulmonary Associates, right? Dr. Matheny and Dr. Wynn.
And also Dr. Malish now.
Oh, that's right. Dr.
Yeah.
Malish is part of that team too. Awesome
Yes.
group of guys.
Yeah.
I've had them all on the show, so.
Yeah, I thoroughly love working with them. So
That's great. That's great. Now, you've been there how long?
I started in September of 2011 with them.
So almost 2 years.
almost 2
That's
years,
great.
yeah.
Time flies when you're having fun.
It does. It's been much faster than I could have ever imagined.
So a nurse practitioner working with pulmonary, exactly what do you do, Jessie?
So I work in the outpatient clinic, and I typically do a lot of the asthma, COPD, sleep apnea follow-ups with our patients.
Okay.
So regular checkups, follow-ups, prescription refills, and sometimes I get to do the exciting new diagnosis stuff with them too.
And find new things.
And find new things and refer them out to if I need to.
Okay, very good. And so nurse practitioner, I know you're actually kind of between a doctor and a physician's assistant, right? I mean,
Similar. Nurse practitioners and PAs or physician's assistants have very similar roles. The big difference is that I practice under my own license.
Right.
And a physician assistant works under the physician's license.
And you can write scripts?
I can write prescriptions, order tests, diagnostics. I can interpret them as I...
So pretty close to the doc, I mean...
Close.
Yeah, almost just about, but not quite. No.
Exactly.
So, have you been a nurse practitioner for a long time?
Actually, I started here. I
this is
graduated
your first?
from my nurse practitioner program in May of 2011,
Oh,
and then started here in September.
So where'd you go to school?
I went to Cal State Long Beach.
Okay, so we're not too far away.
No, not at all.
Did you grow up in California?
I did.
Okay.
I grew up in San Diego area.
Oh, I spent 11 years there. I know it well.
Yeah. So Ramona.
Oh, yeah, I know that area well too. Very good, yeah. We go back every once in a while just to remind ourselves why we don't live there anymore.
Exactly.
Way too many people in a small area.
Yes, I was just there a couple weeks ago, and I don't miss the traffic.
I know. Every time someone here complains about the gridlock on Stockton Hill Road, I just want to go, no, you need to go to San Diego or Las Vegas.
Exactly, or
Phoenix.
LA.
Yeah. Then you'll experience gridlock, and this will seem like a walk in the park.
When it takes an hour and a half to go about 10 miles, then you understand.
Oh my goodness. You know, the I-15, it's scary.
Yeah.
I know. But it's still good. We have both our daughters still live there, so we go back fairly often. But like I said, just enough to remind us why. It's a beautiful place to visit. And I'd love,
Exactly.
just don't want to deal with that every day.
Yes.
Good. So you have family there still?
I have a brother there still, and then my wife's family still lives in San Diego.
Oh, very good. So do you have children?
Not yet.
Not yet? Okay. So been married very long?
Also for 2 years.
Oh, boy, you just did it all. Graduated from school, got married, got a new
Yes.
job. Wow.
My wife and I have actually been dating since high school, and then we got married about 2 years ago, packed up and moved out here to Kingman.
Very good. So you're liking Kingman?
We like it a lot because, like I said earlier, we grew up in Ramona, so it's a small town like it is here, so we're kind of used to it.
Yeah, and Ramona kind of gets the weather too,
Very
higher
very similar weather patterns.
Yeah, so it's almost like being home but not having mom and dad too close, right?
It kind of. My parents are in Havasu.
Oh, they are. Oh, okay. So they're well. That's still. It's not like they're just going to drop in.
Close enough, but far enough.
Yeah. I'm sure they won't watch it. Well, they might watch the show. I'll send you the YouTube, and you can.
Maybe if I tell them about it.
Yeah. Anyway, so let's get back a little bit to pulmonary. Sorry, I get off track sometimes, but I enjoy talking with my guests on the program, getting to know them too. So the pulmonary side of it is the lungs. You were talking about COPD, sleep apnea.
Yeah, asthma.
And asthma. So was that always kind of where your leaning was as a specialty?
Actually, I wasn't quite sure what I wanted to do as a specialty. Going through nurse practitioner schooling, I specialize in family practice, which it allows a broader spectrum, so I can see patients from age 0 to end of life.
Yeah.
Whereas some of the other specialties are more
Focused on it.
So I wanted to do urgent care or emergency care, and that quickly changed after I came out here and met the doctors during my interviews and really started to enjoy what a
well,
pulmonary side
Matheny
of
and
it.
Wynn and Malish are, like we said at the beginning of the show, they're awesome individuals, and just they bring such a quality of care to KRMC and for our patients. It's
And
amazing.
I've truly seen that in just in the 2 years I've been here.
Yeah, I bet. And I'm sure you learn a lot from them too, because they strike me as the types that
Every day, those guys love teaching and
Yeah.
are never afraid to answer a question when I have
That's
it.
great.
So.
That makes a huge difference. And that, so a patient can rest comfortably knowing that if you, for some reason, don't know the answer, you have the resources.
Exactly.
to
I'm
get the answer.
not one that's going to overstep my boundaries and think I know it all. So if I do have a question, I will find the answer for the
Very
patient.
good. Well, and I'm sure it's healthcare in general is an ongoing learning experience, right?
Every day.
Yeah,
Every day.
always. So I'll probably see you. We talked about that earlier. I'm a patient of theirs as well with my sleep apnea. We had Mark Hopkins on the show a couple weeks ago talking about the Sleep Disorder Center, and, the sleep apnea studies and all that. So do you find that one of the things Mark was talking about was how going through the Sleep Disorder Center and helping identify the sleep apnea issues can then make a huge difference in other health issues that a patient
I do see that a lot, actually. Patients are very hesitant when you tell them that they have to be on a CPAP or a BiPAP because it's not natural to have something strapped to your face while you're sleeping. But I've found many times that they wear it, they get a better night's sleep, so their body gets to rejuvenate and refresh itself.
And they wake up feeling better.
They wake up feeling better, and it helps other things such as blood pressures, blood sugars.
Right. Yeah. And it just takes a little while. It's like doing anything new for the first time. Like this, I sleep with a CPAP, and I call it my snuffleupagus. They've heard me talk about that before on the show because it's got that long hose thing, But it does make a difference. And the occasional times when, like, if I'm just going away for a night and think, oh, I don't need my CPAP.
You can
I
tell the
always
difference the next
regret
day.
it. Yeah. So now I just, whenever I go anywhere, it comes with me. If I'm spending the night somewhere, it's with me.
And they're pretty easy to pack up nowadays.
Oh,
they're pretty small.
Yeah, lightweight and easy. And they're actually getting now, because it used to be when you traveled with it, you go through the airport, and it was this big deal, and I didn't dare trust. Well, I tried once. I think I shipped it in my suitcase, and of course, then they had to check the suitcase, see what it was. And I just wasn't comfortable with, because I didn't want to lose my buddy. But as a carry-on for a long time, they were you'd have to take it out just like your laptop. Take it out, and they'd do all that checking, making sure it didn't have any contaminants on it, whatever. But now the last couple of times I've flown, they haven't even done that. They've just put it through the scanner, and so maybe they're getting a little bit more.
I think they're seeing a little more as we get better in diagnosing sleep apnea
more
and
people
finding.
are using them. So that probably makes sense. So again, they're lightweight, easy to carry, and they fit right on your bedside table too. So and like you're talking about now, so you've seen an overall improvement in patients when they go through that sleep study. Now, I haven't ever asked this question, and I don't know, I'll dump this one on you. Can you ever get over sleep apnea?
You can.
Yeah?
It depends on what the cause is.
Okay.
A lot of times we see that weight is a big factor in sleep apnea. And so losing weight helps.
Right.
And actually, it's kind of funny because I went through a sleep study myself, and it was originally to put me through the experience and see what the patients go through.
Yeah.
Well, Dr. Malish read my sleep study and told me that I had mild sleep apnea. Well, he gave me the option of either lose some weight or wear a CPAP.
Oh my.
So I started exercising and eating right again, lost about 15 pounds, and now I don't need to wear one.
Excellent. Well, and Mark was showing on the program a couple weeks ago this new, like a mouthpiece for the real minor or mild cases of sleep apnea.
Yeah, there's
sometimes that will help.
Yeah, it's an oral appliance that helps hold the jaw and the tongue in position so it's not falling back into the airway.
Because that's what causes a lot of it. So that's kind of good news to know that if you, I guess, take better care of yourself, and it is kind of a chicken and egg thing, because we talked about how if you have sleep apnea, it can affect your weight.
Exactly.
You know, the different things, that hormones that we produce, that it's affected by our
so
lack
which
of
came
sleep.
first?
Yeah. So you have to fight all those different issues, and then, but that's good to know that, okay, so I'm going on a stricter diet. No. Maybe someday I won't have to have my snuffleupagus with me.
Maybe.
But I know age has a lot to do with it too, and the muscle tone. We talked about that.
Yeah, exactly.
So have but you've seen people that have been able to overcome that? That's pretty cool. And asthma and COPD are obviously, those are kind of conditions that you have pretty much your entire life. It's just learning to live with it.
Yeah, to a point. I mean, asthma can be a thing of a childhood, and kids can grow out of it. It can also be adult onset and develop it later in life from allergen exposures.
I was just going to ask, is that allergy related?
Correct. Yeah, a lot of asthma is allergy related.
Okay.
And then COPD obviously is sometimes the damage we do to ourselves by smoking, or the jobs that we choose not to wear masks in, and everything that we inhale.
And you know, when we're young, we're so into denial.
Exactly.
Oh, that'll never happen to me.
Yes.
I don't need to worry about that. And then you get older, and
I have a lot of patients that'll tell me that. Say they thought they were invincible, and they never wore their masks, whether they were working on cars or fighting fires, and now they're suffering the
consequences. Well, and it doesn't even have to be necessarily that you are a smoker. I mean, my mother had chronic pulmonary fibrosis, and she never smoked in her life.
Exactly.
But when she was young, back in the days when people could smoke anywhere, she worked in an office with a bunch of writers, and they all smoked at their typewriters, type it away, and the whole room would be smoke-filled.
And that's one of the big developments. I mean, over the last 10, 15 years, we've known that secondhand smoke exposure is damaging, but it's starting to be more prevalent in how bad it truly is for people.
Yeah, because I know when she first was diagnosed, she was like, but I've never smoked and I've never done anything. And then as we talked more, we realized that some of the things that she was just around when she was younger will impact that. And again, you don't see the results right away, so you don't realize the damage that's being done. Well, so note to self, right? We're all getting older. What you do now will affect you when you get older.
Exactly.
Right.
So I'll have to make sure I keep that one in mind.
Yes, absolutely. Even you, Jesse. That's good to know. So now, what is your wife doing?
My wife is a teacher for Kingman Unified School District.
Excellent. We always need more teachers, too. So we're blessed. We got 2 for 1.
Yeah, pretty much.
That's pretty cool.
Yeah, so this year she'll be doing first grade over at Desert Willow.
Very good. That's a fun age when they still want to learn and still think.
And that's why she likes that age.
Absolutely. Makes a lot of sense. And you get a little older, once they get into junior high, I don't think it's quite so much fun anymore.
Yeah, they know they actually understand themselves a little bit and choose to be bad or good.
Right. Yeah, that's very true. Well, and Desert Willow is a nice new school, too. So.
Yeah, I've not been over to the campus yet.
Yeah,
but
it's a real pretty new school. I've been over there a couple of times, so it's very nice. I think she'll enjoy it.
I think so.
School's right around the corner. In fact, by the time this show's on the air, we'll probably have already started school. It's hard to believe, but August, right around the corner.
Less than a month away.
Yeah, and then school starts and the year just starts rolling again.
Exactly.
So what do you guys get to do for this when she's not teaching, you're not working? What do you do for fun?
Well, we go back to California to visit friends and family. Yeah. This summer we've been fortunate enough to take a couple trips. When our friends had their wedding down in the Caribbean.
Oh,
so
nice.
we went down there for a while.
That was good. So you get to go before and after kind of thing?
Before and after, yeah.
Nice.
And then coming up, we're going to be taking a trip over to Europe to pick up my sisters-in-law. They studied abroad this summer, so.
Wow, fun. So you're going to be a chauffeur back or chaperone
Pretty much.
back?
But we get to spend spend some time there and enjoy too.
Very nice. What part of Europe are you going to?
Through Greece.
Oh, excellent. Okay. We're going to take a quick break, and then we'll come back, learn more about you and more about Kingman Pulmonary. Okay? So I hope you will join us. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Jessie Beloussow. Did I get it right that time?
You did.
I did.
Thanks for having me again.
You're a nurse practitioner with Kingman Pulmonary Associates.
Yes.
So you work with Dr. Matheny, Dr. Wynn, and Dr. Malish.
Correct.
So a lot of that, well, pulmonology obviously is lungs,
Yes.
right? So it's you work with patients who have lung issues. We were talking during the break about if like asthma or COPD or emphysema is reversible.
And I wouldn't want to say reversible, but definitely they're treatable.
So you could put it kind of in remission? Would
Yeah,
that be the
I
better
would
word? That
under
it-
control with
Right, so it
certain
doesn't necessarily
medications
get
and
worse.
inhalers. Yeah.
Okay. Oh, inhalers, so what does an inhaler do? I've seen people use them. I've never done it myself.
Well, I guess it really depends, I guess, on which type of inhaler you use.
Oh,
Some of
okay.
them are meant to reduce inflammation within the lungs.
Okay.
Some are to smooth or relax the muscles so they're not
Okay.
spasming, so bronchospasm.
And that's like if you're having an asthmatic
An
attack?
asthma attack or even a
Okay.
COPD exacerbation
Oh,
sometimes.
okay. And that'll help
Open the
them up
airways.
so you
Mhm.
can breathe better.
Exactly.
Obviously, that's the whole point. So, putting things into remission so they don't get any worse. Obviously, that means that it's important you catch it as soon as possible.
Yes.
We were talking also about some of the things that can cause that. So, smoking obviously is one of our big thing, especially here in Mojave County. I think
Exactly.
30% of the population smoke here. You'd think the Marlboro Man was from Mojave County.
Possibly.
Anyway, but so smoking, but then we talked about asbestos, working with asbestos.
Asbestos, yeah, not so much as anymore. I mean, it's
we've
still
kinda got
around,
rid
but
of
we've learned how bad it can be. But previously in paints or even pipe linings, a lot of Navy ships used to use asbestos in their
Yes.
pipe linings or
Okay.
even in their respirator masks at one point in
Really?
time.
They had asbestos in their respirator mask?
I did not know that actually until I started working with Dr. Matheny, and they
Really?
had talked to me about
What is
that.
supposed to be like a filtering system?
They used to use them in the filters.
Wow.
Not
that's
anymore,
kind of, Yeah,
obviously.
obviously. They figured that out. Not so good. Oh my
Yeah.
goodness, how scary. So, all of those things then can lead to pulmonary distress, issues with your lungs. How do you identify? I mean, how does a person know that they're having pulmonary issues?
The earliest signs are dyspnea on exertion or
Which-
just shortness of breath. So
Oh, okay.
shortness of breath with activity.
Okay.
You're starting to feel easily winded when doing simple things, whether it's walking or
Well, and that can be kind of, I mean, I know myself, having with the weight or whatever, and I'm doing some stuff that I can sometimes have shortness of breath, but it's not all the time.
exactly.
So,
And that's one of the difficulties in figuring out what is the cause, because sometimes shortness of breath can be just being out of shape
Right.
or not exercising. It could be heart related. It could be lung related.
so it's identifying what the issues
Exactly.
are. Okay. And can you tell that from listening? Do you usually, from the lung side of it? Is that,
Listening helps us get an idea of maybe something's going on in there
Okay.
and see if there's how well you move your air through your lungs. We also do pulmonary function testing,
okay.
chest x-rays or CAT scans.
So the pulmonary function testing, is that where you're breathing into a tube sort of thing and it
Yeah,
measures?
we have a pulmonary function machine and lab in our office.
Okay.
And our respiratory therapist will coach patients through some breathing exercises
Okay.
that the computer then measures how much air you can breathe in or exhale.
Okay.
And-
And that tells you how
and that-
much the lungs are working?
Yeah, it gives us an idea of compared to what we consider a normal.
Right, okay, so
healthy
you have like a
person.
benchmark for a normal, healthy person, and then above
Yeah.
or below the line kind
Yeah,
of
and
thing.
it's all calculated for age, sex, height, weight.
Yeah, all those things play a factor,
Exactly.
obviously, in how well we can breathe. So those x-rays, I mean, if, for instance, I'm not, but just say I was someone who had been exposed to asbestos a lot when I was younger, is that something I should have checked on a regular basis? Or
I would say get it checked at least once. I mean,
Okay.
have a chest X-ray done, and then depending on what we see, what the results are, it would determine if we need to continue following them or
okay,
not.
okay. So if it's clear, then you're probably, oh, you're good for another 5 years, whatever.
Exactly.
But if there's some shadows or issues there, then you'd be able to identify it.
And get further imaging if we need to, or other testing.
Okay. Now, if a patient is having, or a person is having some of those issues, do they need a referral to come and see Kingman Pulmonary, or do they just
Not
call
usually.
them? Okay.
Not usually.
So they can just come right to the office or call to make an appointment.
And I think sometimes it depends on insurance,
Sure.
if it's there, and what kind the patient has, if they need the referral.
Well, the good thing is they can go to our website, the azkrmc.com, under Find a Physician, and you're there, and Matheny's there, and Malish and Wynn are all listed there. They can find your information, get your bio and all of that, as well as the address and the phone number, how to get a hold of you guys. So that'll be good for that. So the other thing I wanted to talk a little bit more about was being a nurse practitioner and how, the steps to becoming that. I mean, you start out going through your basic kind of prereqs of nursing?
Yeah, so traditionally, becoming a nurse was an associate's degree, and they added then a bachelor's degree programs, which is a lot of people do. And then after that, you take your national certification licensing and get your registered nurse license.
The RN.
The RN.
Okay.
To become a nurse practitioner, it's actually now required that you go through a Master's of Science in Nursing program.
Okay, so that's 2 more years? Or
2 more years on top of the traditional bachelor's degree.
And does that focus more on a specialty, or is it focused on nursing?
A little bit of both.
Okay.
We still use the nursing model and theories as far as treatments and diagnostics.
Okay.
But we do go through some of the medical training as far as how to diagnose, what do disease states consist of in treatments.
Okay. And then can you go into a specialty from there?
You can.
Okay.
So the major specialties in nurse practitioners right now are there's family practice, women's health, psychiatric mental health, pediatrics, and then adult geriatrics.
Oh, okay.
Or you can also do an acute care, critical care specialty.
And that's kind of where you're going?
That's where I'm headed now.
Okay.
I'm currently in my acute care, critical care coursework.
Okay, very good. And is that kind of online courses that you're able to take?
I do get to do a lot of courses online because the school's actually in California.
Right.
But once a semester, I go and I'm on campus for a week, so we do hands-on training and lectures.
Very good. So it's not just
It's not just
in
all
front of a computer.
No,
You're actually getting some
I get some hands-on, and then I
awesome.
actually get to work with my partners, Dr. Matheny, Dr. Malish, and Dr. Wynn, and they do a lot of the on-the-job training with me too in those
that's
clinical
excellent.
practices.
Like we talked about before the break, that I don't think you could have picked a better group
Yeah.
to be a part of.
Yeah, so I get to round through the ICU with them and see
excellent.
patients there and get a little more in depth as far as what's going on with people. And
So when you get this next degree, that'll be a doctorate. You were sharing with me. So will you still be considered a nurse practitioner? Or?
Still a nurse practitioner.
Okay.
I'll have my doctorates of nursing. It's similar. We're trying to differentiate between PhDs in nursing right now and doctorates of nursing as far as
it's kind of complicated.
The difference is the PhD is a research-based degree, and the DNP, or the doctorates of nursing practice, is more of a clinical hands-on side.
Okay. So for our young people today that are looking at going into the medical field, what would you say if they're trying to decide, do I want to be a nurse or nurse practitioner or a doctor? I mean, education-wise, it sounds like your doctor of nurse practitioner is going to be pretty amount of same education as a doctor.
Length of time is pretty similar.
Right.
Maybe
so it's not a shortened time.
Not necessarily. It's just a different model of how you want to care for patients.
Okay.
Whereas doctors and physician's assistants go through a medical theory.
Well, thank you, Jesse, for being on the program today.
Anytime.
I've learned a lot. I appreciate it. And I hope you learned something today, too. Join us again next week when we'll have another great guest in the program.